is prostatic artery embolization and when is it needed?
Prostate artery embolization is a procedure which we do in patients who have enlarged prostate. Basically, in people who have enlarged prostate, that is benign prostatic hypertrophy. Okay, and also in patients who present with other symptoms that may not be directly because of the enlarged prostate, but due to the symptoms arising due to the enlarged prostate. Basically, they present with symptoms such as frequency in urination, urgency, and hesitancy in urination. They also have hematuria, erectile dysfunction. So these are all the people who may require prostatic artery embolization.
Why is prostatic artery embolization better than the conventional modality of management?
Earlier, the options were direct surgical treatments. When you come to the interventional care, this procedure is almost a daycare procedure. It doesn't require anesthesia, and the patient goes back to home then the same day and can resume his activities the next day, as it doesn't involve a surgical kind of intervention. So overall, this being a minimally invasive procedure where a fine cannula is put either in the groin or the hand, and a catheter is directed all the way to the prostate, and on selective cannulation of the prostatic artery, fine particles are released which will cut off the blood supply to the prostate, causing it to decrease in size.
What is your clinical experience on the results that you have witnessed in your patients?
The thing is, the data shows that all this data shows that this is a very simplest procedure where the patient compliance is very good with this, because they don't have to follow much of the things as like in a surgical procedure, and the outcomes are really great. The studies will definitely prove that prostatic artery embolization will be the cutting edge for benign prostate hypertrophy management.
What is the message that you would want to give to the GPs regarding managing their patients after this procedure has been done by an interventional radiologist?
To tackle the post-embolization syndrome, that is the edema happening around the urethra, ureter and urethra, so that the edema will cause the retention of the urine. So, however, the policy is placed, which will help in managing the flow of urine for the next 1-2 days. So basically, the patient, we advise to retain that police for a day or two, since till the edema comes down. Otherwise, I think he can manage the rest of things, because there's not much medical management, since the infection rates are low and the results are good with the patient walking up the next day. So evaluation is basically I advise the general practitioners to get a urine analysis, then truss scan of the prostate, then if required MRI or CT for the anatomy of the prostate, so as to plan the angiogram and embolization. Finally, the prostate antigens things